let's talk a little bit about lifestyle. So many people ask me, Doc, how can I prevent heart disease and cancer? And they ask me this many times because they know that there's a linkage between the two, but they're not exactly sure what they are. So the truth is, all disease shares one common entity, which is inflammation. And there's a way to put your body into an anti-inflammatory environment if you just know how. So really, there are 5 important tenets of lifestyle that I share with all of my patients, whether they have heart disease or cancer. But it turns out this very approach is both anti-heart disease and anti-cancer, so it's a win for everybody. So what is this approach? Well, first, it's a predominantly plant-based diet. And what I tell people is you can eat potato chips and Oreo cookies and Coca-Cola and think that you're eating a plant-based diet, and you are, but that's not the kind of healthy food that I ask people to try to eat. I really want people to eat a low-fat, whole food, minimally processed plant-based diet, which of course is not an easy thing to do unless you really try to do it, right? So, if you say to me, well, I had a salad, but I put blue cheese dressing on it, well, that sort of converted it into a cheeseburger. So we're really trying our best to eat in a way that is nutritious and also will help to cut inflammation, which is a fully plant-based diet. So diet is one. The other is exercise. Super underestimated how important this is, but exercise is the best therapy to reduce the risk of heart disease, and also many cancers respond to regular exercise. And it doesn't have to be anything fancy. You don't have to join a gym. You don't have to get a Peloton bike. If you want to do those things, feel free. But 30 minutes every day of breathless physical activity truly does help to keep the doctor away. But make sure, of course, you check with your doctor first, because the last thing you want to do is exercise when you're in a very fragile state. So diet and exercise. The third is stress. A lot of people don't realize how stressful it is to be sick, to have cancer, to survive cancer, to be treated for cancer, to have heart disease, or any combination of those things is very stressful. In addition to, being in a relationship with a partner, or having children, or working every day, or whatever stress maybe you received from your parents growing up. But whatever it is, it's all this stress that accumulates and can make heart disease and cancer much more difficult to treat. So I encourage people to spend 30 minutes every day to meditate or do something mindful. It could be as simple as going for a walk in the woods, or sitting outside, or looking at the stars. But whatever it is, try to do something every day that gets rid of that stress. So diet, exercise, and stress. The next one, very underestimated, is connection and support. A lot of people don't realize just how important it is to have regularly good connections with people. So that could be your spouse, it could be a significant other, it could be a friend, a family, a churchgoer. But having a good, solid support network actually reduces the likelihood of worsened heart disease. And in fact, married men, as an example, tend to live longer. There's real truth to that. So spend time nurturing those relationships that are important to you. The last one, and the fifth one, is sleep. So a lot of people underestimate how important it is to sleep, and everyone says, oh, I sleep enough, or I sleep, don't worry about it. But the truth is, you need 7 hours a night, which is the sweet spot of uninterrupted sleep. So if you're getting up all night long and you are using the bathroom, or you're disturbed because of a bad dream, or whatever it is, you're not getting enough uninterrupted sleep time, and this is where the best outcomes come from. So in short, 5 important points, which are eating mostly plants, exercising more, stressing less, loving more, and sleeping enough. This will do wonders to fight the vast majority of disease, but importantly, cardiovascular disease and cancer both.